Over the last 24 hours, we have identified 692 new cases of COVID-19 and completed about 12,800 tests. Our current positivity rate is about 5.3%. We have identified 202 additional cases of variants of concern. Variants currently represent about 19% of our active cases. We have identified the first 2 community-acquired cases of the P1 variant, which were among those reported yesterday. Follow-up is ongoing to prevent further spread. Looking to schools, there are currently active alerts or outbreaks in 363 schools, or about 15% of schools in the province. These schools have a combined total of 1,550 cases since January 11th. There are 285 people in hospital, including 53 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health over the past 24 hours. My sympathies go to the family and friends of these individuals and to anyone who is grieving the loss of a loved one. We have now administered more than 512,000 doses of vaccine in the province. I want to thank the more than 418,000 Albertans who have signed up to be immunized. I know that there are still questions from some Albertans about whether or not the AstraZeneca vaccine is still safe to take. Based on all the evidence available from trials and real-world experience over the past few months, Health Canada has found that the vaccine is indeed safe and effective at preventing serious illness and death from COVID-19. The data also shows that there is no increase in the overall risk of blood clots for those who receive the AstraZeneca vaccine. In fact, the numbers out of Europe, 37 cases of blood clots among the more than 17 million doses, are lower than we would expect to see in the general population without vaccination. Having said that, it is important to acknowledge one particular outcome that has been seen with higher frequency in some people who have received AstraZeneca vaccine. In a very small number of people who received the vaccine, in the 2 weeks afterwards, a blood clot in the brain was reported. It is not clear yet if the vaccine caused this issue, but in order to be cautious, Health Canada is adding a warning to the Canadian label on this vaccine. This condition is treatable and very rare. Globally, this outcome has been reported in about 1 in 1 million doses, mainly in individuals under the age of 55. When considering this, it's also important to remember that COVID-19 infection significantly increases the risk of blood clots and other serious health issues. In fact, an unvaccinated person in Alberta between the ages of 20 and 49 has, on average, a 500 times higher risk of dying from COVID-19 after testing positive than having one of these rare types of blood clots after immunization. Vaccines save lives, both your own and those around you. I continue encouraging everyone to get their dose as soon as they are eligible. We're absolutely looking into multiple different outbreaks right now. There have been some outbreaks linked to restaurants, some outbreaks linked to different work sites, outbreaks, again, linked to multiple different settings, social gatherings. And I think what's really important for people to remember is that the impact of any particular single outbreak can be contained if those who are involved in that outbreak are considering protective actions in other aspects of their lives. So what we're seeing, again, wherever the initial spread happens, is that the magnitude of the number of people who are essentially impacted in the generations of spread that follows is amplified when people are not following public health measures in multiple aspects of their lives. So again, it's not one single area that's responsible for spread, and we are looking very closely to understand if there are any activities currently that may be higher risk than others, but at the moment, again, we're seeing that the biggest risk is when people are tired and leaving aside those public health measures, and spread happens not just in a single setting, but it happens in that setting, and then it happens in households, and then it happens in other workplaces from other people in those households, and it can continue to spread with multiple generations of spread happening even in a single week. So again, the important thing is that we all continue to follow the measures. as best we can every day in every setting we're in.
Operate.
What we know is that in other places where variant strains have become dominant, that additional restrictions have been required. And we see in many countries in Europe, we saw in the UK earlier this year, that the variant strains rise very quickly, and that in some cases those additional restrictions have been needed to prevent further spread and to prevent that impact on hospitals and ICUs. What we need to do in Alberta is up to all of us. And the next few weeks really are going to be a measure of how we are all collectively making choices, prioritizing our community, preventing that spread within the current public health measures. If spread escalates, if we're seeing the spread and the transmission of our cases, and particularly variant cases, continuing to rise, it may be possible, it may be necessary to bring in additional restrictions.